Have you heard about personalized medicine? Perhaps in the media or through your doctors. In this video by the McGill University Center of Genomics and Policy, we will be explaining what personalized medicine is all about. The evolution of medicine. Before personalized medicine, healthcare took a one-size-fits-all approach. For example, if you had a headache, the doctor would prescribe you a medicine that is normally or often prescribed for those who have headaches. But it is possible that headache medicine does not work for you, even though it has helped many other people. It's like if you needed a new shirt, and the salesperson at the store picked out any shirt off the rack for you without considering your size. Okay, but why do some medications work for some people and not others, even if these people share the same condition or symptoms? All humans are different because of their genes or their DNA. Your genes can determine things like your appearance, like your hair and eye color, but they can also determine if you have a certain health condition or disease, and importantly, how your body will react to certain medications or therapies. So, what is personalized medicine, and how does it relate to your genes? Unlike the one-size-fits-all approach, personalized medicine takes into consideration your genes and DNA. It is more personalized because the doctor will order certain methods of prevention, diagnosis, or treatments according to your genes and your body's reaction to certain treatments. Personalized medicine also considers things like your family history, lifestyle, or your environment to see if these things play a role in your health. Using genetic tests, we can identify the precise variation or change in a person's genetic code. This gives us information about how to treat it and how to pick the shirt that would fit you. How does personalized medicine work in cystic fibrosis? In the case of cystic fibrosis, many patients are affected by some variation of the CFTR gene. But there are more than 2,000 different mutations in the CFTR gene, and many of these can change CFTR function and cause cystic fibrosis. How each mutation causes different symptoms for each person can also be affected by many other genes too. So, imagine trying to prescribe a medication for CF patients. Patients that have different symptoms or may react to medications differently because they all have a different set of genes. Instead of just treating those symptoms, personalized medicine aims to look at an individual's variations to find the best treatment for that individual. An example of personalized medicine in cystic fibrosis. Kalydeco is a good example of personalized medicine. It treats those patients with a specific CFTR gene variation. The benefits of Kalydeco is that it targets the underlying cause of cystic fibrosis in people with that specific variation. But along with its benefits, there are some challenges to personalized medicine. For example, only about 4% of individuals with cystic fibrosis have the particular genetic variation that Kalydeco treats. This means that only 1 out of every 25 patients is eligible to use Kalydeco. These treatments can also be very expensive depending on healthcare coverage and personal insurance. Taken together, these considerations can limit the accessibility of personalized medicine. What does personalized medicine have to do with me? The more we learn and explore the area of genetics, the better we are at finding treatments and therapies for people. Cystic fibrosis researchers are working hard to find which patients respond to certain personalized medicines. They are also working on identifying rare CFTR variations to one day develop other personalized treatments. This will help patients access therapies more quickly and safely. While existing personalized medicines may not be right for your specific genetic profile, participating in research could help advance the science to help develop new treatments and therapies in the future. What does research for personalized medicine look like? Participation in personalized medicine research will likely include a genetic test. It means researchers will have access to your and your family's DNA makeup. Your consent is important because it tells the researcher what they can do with your DNA samples and data. Are you okay with storing your sample in a biobank? Are you okay with future uses of your data in other studies? Do you expect the research team to inform you of your results? How does your family feel about sharing genetic information? These are all things to consider before participating in research for personalized medicine. Want more information on the consent process? Click the link below to watch our video on informed consent for future participants of genomic research. Personalized medicine research uses your genetic information to help tailor treatments for patients with the same genetic variation as you. Right now, not many personalized medicines are made available to patients. The existing ones are expensive and are limited to those who have a particular variation in their DNA. If you are interested, ask your doctor how you can participate in personalized medicine research to help patients like you and others in the future.